My name is Patricia. I'm a midwife. I'm going to be taking you through the steps of newborn resuscitation. One of the things that we have to note as midwives that our resuscitation tray has to always be ready whenever we are anticipating to conduct a delivery. So these are the items that are on my resuscitation tray. This is a penguin sucker, and I have masks. These are masks of various sizes. This is size 0 and this is size 1. This is my ambu bag. I have my nasal prongs ready. I have my cannula for the neonate. I have dextrose 10% is ready. This is my stethoscope that I'm going to use to listen to the heart rate of the neonate. And I have an oxygen source that is just near the infant warmer. So immediately the baby is born, all our items have to be very, very ready, because anytime we might need to support this baby to breathe. So this is a demo of a baby that has been delivered but is not able to breathe. So these are the steps that I'm going to be taking you through on newborn resuscitation. One, the moment the baby is born and you've noted that the baby is not breathing, you have to ensure that you stimulate this baby. Remember, as we have delivered the baby to the mother's abdomen, you're drying thoroughly. As you dry this baby, you're also stimulating. But you've noted that the baby is not breathing, you're going to also rub the back. We have to do it in this kind of motion at least 3 times. 1, 2, 3. The baby is not breathing. So if the baby is not breathing, as midwives, we have to transfer this baby to the resuscitation corner. And this is my resuscitation corner, where I'm going to resuscitate my baby effectively to ensure that the baby can be able to breathe. So the next step that I'm going to go through, in case there are any visible secretions, try to clear the airway. And I'm going to use my penguin sucker. I'm going to remove the secretion starting from the mouth, then to the nose. So I've removed all the secretions, but the baby is not breathing. So the next thing I'm going to do is to start positive pressure ventilation, and I'm going to use my ambu bag that I've already prepared. And we have to be swift as we are doing all these steps, because we want to ensure that our baby survives and thrives after. So I'm going to apply the mask. One of the things that we have to note is the correct positioning of the baby. This baby has to be in neutral position or sniffing position. So my baby is basically in the sniffing position. So I'm going to position this mask well. So after positioning the mask, I'm going to start effective pressure ventilation using ambu bag. So one of the things that you have to note is correct positioning of the baby's head and also forming a firm seal. So you can confirm that you made a firm seal if there is a chest raise. So there is a chest raise for this baby. So as you are bagging the baby, you have to ensure that you give at least 40 to 60 breaths in 1 minute. So my baby's chest is really moving, and we are doing well via ventilation. But as I'm bagging this baby, I've noted that the chest is not moving. So I'm going to go to the next step of improving ventilation. And under improving ventilation, we have going to go through some steps. 1, I'm going to check if there are any visible secretions. I'm going to remove them using my penguin sucker, because in case of secretions, they can also occlude the airway. So I've removed them. Then I'm going to reposition the baby. Just as we say, the baby has to be in neutral position. I'm going to reapply the mask. So I've reapplied. I'm going to give 3 some wood ventilations. 1, 2, 3. So those are the steps that I'm going to go through in improving ventilation. And we have to ensure that as we're doing that, because most times we are alone in our settings. So in case you are alone, you have to do all that you can to ensure that you help this baby. So I'm going to position my stethoscope to count the heart rate of this baby. So you can either use an umbilical cord or you can listen to the chest. So I've noted that the heart rate of my baby is 54. So if the heart rate is 54, that is really a low heart rate. I'm going to continue bagging, but now I'm going to go to the next step of chest compression. and I'm going to give 3 chest compression and 1 breath. So in case you are alone, you can do this when you are alone, because most times as midwives we work one in some settings. But under normal circumstances, this is a 2 nurses procedure, so you call your assistant to support you. So in instances where you're alone as a midwife, this is what you do when you're doing chest compression. I'll say you give 3 chest compressions and 1 breath. So I'm going to do this 1, 2, 3, breathe. 1, 2, 3, breathe. 1, 2, 3, breathe. So this is what you do, and you have to ensure that you position your hands well, the fingers, then you give this baby a breath. So having done chest compression, we only do it if the heart rate remains persistently low, that is below 60. So in case the heart rate of our baby has not improved, I'm going to administer some drugs. And this is the drug that we had already prepared. This is adrenaline, and we have to ensure that we give the correct dosage to our baby. And the dosage is 0.01 milligram per kilogram body weight. So you dilute it and then you give, preferably we can give it as an IV. So having given my drug to the baby, I'm going to continue. Don't initiate this baby on oxygen if it is not breathing. You wouldn't have done good to this baby. So having done my resuscitation well, my baby started crying. So this is really good. But as a midwife, you have to ensure that you continuously monitor this baby. And there are some babies that you can resuscitate, but they continue post-resuscitation care. And this might involve maybe giving this baby oxygen support. So I'm going to connect and give my baby oxygen, and I continue monitoring. For the monitoring, at least do it every 15 minutes until when the baby is stabilized. In instances where I need detail, I can always give, because we want to prevent also hypoglycemia. Thank you so much for listening.